Did you know 76% of pregnancy-related deaths are preventable? What is maternal mortality? It's when a mother dies from a pregnancy-related health issue or an existing condition exacerbated by pregnancy. Most people might think that maternal mortality is not an issue that we need to be concerned with in the United States, but the statistics are outstanding.
In 2022, 817 U.S. women died from maternal causes. Women in the U.S. are 4 times more likely to die from complications compared to other high-income countries.
There was a reported over 18% increase in maternal deaths in the U.S. between 2019 and 2020. The greater increase was between Black and Hispanic women compared to white women. The World Health Organization shows that 75% of maternal deaths are due to severe bleeding, infections, and high blood pressure.
New York is home to some of the most advanced hospitals in the world. Yet despite this technology and expertise, New York has one of the most disparaging maternal mortality rates in the United States and other countries. Imagine this, a mother in New York is 3 times more likely to die from childbirth than a mother in France, the UK, or Canada. And within our state, Black women are even more likely to die from pregnancy-related complications than white women. How can this be happening here in a city known for world-class healthcare? Let's take a closer look at the forces driving the alarming numbers and what we can do to change them. The overall pregnancy-related mortality ratio in the United States was 20.4 per 100,000 live births from 2018 to 2020. The overall pregnancy-related mortality ratio in New York State was 18.5 deaths per 100,000 live births.
Doesn't seem too bad, right? But when we take a closer look, things change drastically.
When we look again at New York City rates and take maternal race and ethnicity into account, we see that Black, non-Hispanic women had a pregnancy-related mortality ratio over 4 times higher than white non-Hispanic women.
Like we said before, we know New York City hospitals are some of the most famous in the world. So these high mortality rates must be happening outside facilities and babies' homes, right? Well, not quite.
As we can see here, more than half of these deaths happened inside an inpatient setting, and worse, the data shows that they were more than likely preventable.
This is a tremendous disparity with many contributing factors, but it is imperative to put pressure on the government policymakers and make major healthcare systems to raise their standards. But even more importantly, providing education for future mothers, expecting parents, and more. Here's how to take action and reduce risks for yourself or a loved one.
It is always important to keep an eye on your loved ones during their pregnancy and after. Make sure you look out for signs of depression, such as loneliness, lack of interest in their activities that they liked before, or just sadness. Make sure the woman has a support system, not just for childcare after she gives birth, but also for support after pregnancy. Establish a village for the women so that she feels supported both physically and emotionally.
It's super important to start care during pregnancy and after pregnancy. It's easy to dismiss symptoms as normal, so here's what you can do to lower your risk. Talk to your doctor and start care early. Try to practice good hand hygiene, like washing your hands with soap and warm water to prevent infection. Find ways to reduce stress, like walking or slight exercising.
Here are some things you should look out for while pregnant. They may be urgent signs that need to be addressed to prevent maternal death.
Headaches that won't go away or get worse over time.
Dizziness, fainting, blurred vision, or blind spots.
Fever or extreme swelling of your hands and face, not like the usual swelling that most have during the last few months of pregnancy.
Trouble breathing, chest pain, or fast beating heart, or continuing to throw up after the first trimester.
Sharp belly pain that doesn't go away.
If the baby's movements stop or slow. Also, vaginal bleeding or fluid leaking during pregnancy. And here are some ways you can bring up concerns to your provider.
Thank you for seeing me today. I'm recently pregnant. My last period was on September 20th, and I'm having some serious concerns about my health that I'd like to talk to you about.
I've been having abdominal pain, like cramping. It's been on and off for like about a week now.
What could these symptoms mean? And is there a test that can rule out a serious problem?
At what point should I consider going to the emergency room or calling 911? Reducing maternity mortality starts with awareness, knowing the signs and understanding the risk, and demanding better. Do not hesitate to seek help for yourself or loved ones, and do not settle for our healthcare system. No child should grow without their mother. Together, we can change this.